welcome to Fox Valley Today. I'm your host, Anne Vickery. Joining me from the Oswego Senior Center in Oswego is Executive Director Sandy Pastore. Sandy, good morning, welcome.
Good morning, thanks for having me.
Well, glad you could come over on this rather chilly morning today. I mean, if they rerun this program in July, then
yeah,
we'll probably
we look all bundled.
Yeah.
It's because it's cold outside right now, I
And
promise.
it is kind of close to Valentine's Day, right?
Yeah, hey, all right.
So, Sandy, why don't we just kind of start by letting you tell us what's going on over there? And there are some things that I've kind of looked through that I kind of want to hit on, so go ahead.
Okay. Well, our big event coming up is our Valentine Dinner Dance.
Uh-huh.
We have this every year, and it's just a lot of fun. Tickets are $20 a piece, or 2 for $35, and the 2 can just be you and a friend. It doesn't have to be you and a partner.
Yeah, just come and have a good time.
2. And so it's going to be at the Oswego Kickers Club again this year, and Edison Deo will be performing, and he's really just great, and people get up and dance, and people are swing dancing. It's amazing the way these people move. So
well, and you can, dancing is kind of one of those things you can, whatever the beat you feel is the pace that you can go.
Right.
So
And
that's
it's
fun.
Just good. So we'll have a good dinner. Upper Crust will be catering it for us. So tickets are on sale, and you can buy them online, and it's going to be Saturday, February 10th.
Okay. Sounds like a nice night.
Yeah, it'll be a lot of fun. So we have that coming up. We also have our Healthy Habits starting back up February 16th. So if you made some goals for lifestyle change, maybe a New Year's resolution, or you just have this urge that, I think I need to do something, then this class is for you.
And what will it cover?
Well, our first class is going to be finding the track in order to get on it.
Oh, yeah. Oh, okay.
Yeah, so getting on track.
List the things that you might think are the most important.
Yeah, so we'll look at goal setting, we'll look at motivation, we'll look at nutrition, like the realities of nutrition, how to read nutrition labels, how to know what you're eating and if it's good for you or not, how to shop at a grocery store to avoid problem areas, because that's really where people get in a lot of trouble, is grocery stores and drive-thrus.
Well, do you think that because people get, so many people live alone, a lot of people don't like to cook for themselves, that they may pick up frozen foods that are usually high in sodium and preservatives, and
we do find that a lot, that people are eating the frozen meals that are high in sodium and not really realizing, thinking that, because it says it's smart or lean, that it's good for you.
It's good for you, yeah.
And you really need to look at the sodium on the back of those. So we'll also be doing cooking demonstrations and tasting demos and exercise demos, and just helping people accumulate the knowledge and application for these different practices so that they can go forward and make sustainable lifestyle changes.
And I think some of those things are good because you get a lot of interaction, I'm sure, from people who say, I didn't know that, or why shouldn't I eat these certain things?
Right, and I think there's a lot of myths out there too that people just don't really understand. You get a blimit on the media about this is what the new study says, and you know what I mean. And if you don't go and read the 30-page study, then you're missing a lot of information. Right. So, we really stress that diet is a 4-letter word, is what we say, because diet has a start and an end, which means you're going to begin something and then you're going to go back to the way you were. And so what really needs to happen is a lifestyle change, and so we just want to promote and help educate on sustainable lifestyle changes that are not
so drastic.
Not so drastic and not so, crazy that you're not going to keep it. And
I think that's what a lot of people, but in the same token, I'm at an age where I'm not going to do anything drastic.
Right.
Well, I can't maybe not in the way of a diet, but there's still some drasticness in me somewhere,
yeah,
I'm sure.
I'm sure.
But I just don't worry about it that much. I mean, could I lose 20 pounds? Absolutely. Should I do a few things a little bit more or some things a little bit less? But basically I'm a pretty healthy person. And knock on wood.
Yeah, and so you're on one end, and there's other people out there that are not like you and maybe feel like their energy is really low, and that can all be attributed to diet and exercise.
And it can just sometimes be attributed to this time of year. It's cold. It's not pleasant to go anywhere. Every place you go is a real effort. You have to bundle up, watch for the ice, warm up the car.
Yeah.
You know, everything is. It's not like you just run out of the house in your t-shirt and khakis and jump in the car and put the sunroof back and go.
Right, but this is a great time of year to get into healthy habits, because then by the time spring and summer comes along, you'll be feeling great and you'll be ready to go.
Yeah, well, I'm going to try to feel great anyway. Okay, so what else have you got?
We got our financial education series coming up, Ways to Reduce Taxable Income. That's going to be on February 13th. It's every second Tuesday of the month. So we talk about something financial. David Erickson and Brian LeClaire come in. So they give kind of two different viewpoints on different things and have different information. So it's good.
So it's a little late for this year, but it's
for next. Yeah, so
year.
we're just in February, so it's a good idea to think about how to reduce your taxable income over the longevity of the year, so that when you get to December, you're not like, oh, shoot.
Yeah, should have done. And you know, and I think some other things here, you know, even though the tax reform, tax changes that was passed by the federal government and signed by our president, and was promoted, they are, even though they talk a lot about them having the biggest effect on corporations, they are going to have an effect on everyday normal citizens.
They will, and it depends on where you know, just looking at the tax brackets that I saw online, it looked like it depends on where you fall and if you're single or married as to how it'll impact you.
Well, and I mean, I think this year, or next year, I guess it will take effect this year, 2018. You know, a couple is going to get an automatic $25,000 deduction, you know, before you itemize. If you can itemize past that, then you go up.
Right.
But there's a lot of couples with heavy medical expenses. If you have Medicare, you have supplemental, let's say you have some dental insurance, nursing home insurance, you have a high deductible on some of these things, it's pretty easy to hit $20,000 or $25,000 a year.
Right.
It really is. So I think this is a good idea because it makes people aware, you know, keep track of stuff.
Yeah.
Keep good records.
And talking about taxes, we have our volunteer income tax assistance program starting February 6th, I believe. So we're taking appointments now for it. So if you need your taxes done, there's some guidelines for it. I think it's $55,000 or less.
And short form.
In short form,
Yeah.
Nothing complicated. You can't have investment properties and things like that.
Yeah.
But they're taking appointments now, so you can call the senior center and make your appointment. And they're going to ask you if you have all of this information, because you need to have all of your information before you can make your appointment this year, because we don't want people coming in and being like, oh, I didn't know.
Right.
So, there's a list of it, and I don't know it off the top of my head.
Well, yeah, but I think, you know, so they can call over to the Oswego Senior Center and set up an appointment or find out what the parameters are.
Yep.
Okay.
We got our caregiver education coming up. We do this every month, our caregiver education series. This month we're going to talk about affording longevity. How do you pay?
And you have some ideas on that?
Sell your house. Yeah.
Yeah.
I mean, that's really what it comes down to. If you don't have long-term care insurance and you don't have enough savings built up, then the result is usually you sell your home.
I know you're not into the financial things, but do you see a lot of seniors doing the reverse mortgage?
I don't.
Yeah.
But I don't know either. They don't necessarily tell me.
A lot of people don't want to talk about it, because it's the last thing that they really have.
Right.
So, and I think what's probably pushing a lot of people out and making things so unbelievably difficult are the very, very high taxes in this county.
Yeah. I think, you know, reverse mortgages, they were kind of, you know, pretty popular maybe 15 years ago. They were kind of on an upswing, but I really haven't heard a lot about that in the senior world. There hasn't been any real advocacy for that.
Right.
You know, just here and there. And it's just, you have to be really careful, because if you're too young when you do that, it could really backfire.
Right, because pretty soon you're going to find yourself out of the house and not being able to pay for anything.
Right.
Yeah, okay.
So you got to be careful with that. But yeah, so we have doctor's notes coming up. We're talking about active seniors, dental health So Dr. Rohi Atasi from Valley View Dental will be in to talk about that. You know, Medicare doesn't cover dental for the most part. There's Medicare Advantage plans that cover some preventative dental, like cleanings and things like that. And they're getting a little better, but original Medicare does not cover dental.
Okay.
Or vision, or
Right,
hearing.
or hearing aids.
Yeah.
Right.
So, you know, a lot of dentists do have plans available through their offices. If you call to seniors or people without dental insurance. So, you know, check into, if you are a senior on Medicare and you have original Medicare, there's private and dental plans that you can purchase.
Right.
But there's also, you know, check with the dentist that you use, see what they use there, and or see if you can negotiate.
And sometimes it doesn't hurt to say to your dentist, you know, I need to have this done, but I simply can't afford $2,500.
Right.
I can pay this much, or I can pay you some money a month, but I can't do this.
And I've found that dentists are, you know, they work with people.
Right.
So so call around and find out. But they're new in town, this Valley View Dental, so they're coming over to talk about dental health.
Let me ask you a question. Why do they say dental health is so important towards cardiovascular?
It's due to the plaque buildup in the body. It has a connection there with the plaque buildup in your teeth and the plaque buildup in your arteries. Yeah.
Yeah, and I know that people who are of a compromised immune system, going to get your teeth cleaned can become, you know, something that can set off a bigger, deeper problem too.
Right. Yeah, if you take certain medications.
Right.
But that's all something that, you know, you can talk
about with your dentist. Sure. And you're still doing your international cooking class.
Yes.
What's coming up?
We got California fish tacos because it's going to be Lent. Because it's a Friday.
What kind of fish are you going to fix?
Cod.
Oh, that sounds good.
Cod. So we'll do cod, fish tacos with crema with cilantro and lime.
What is crema? What is that?
Sour cream.
Oh, get it.
It's a little looser though.
A little cilantro and some lime. And what else?
And then we'll make tortillas from scratch.
And how do you fix the cod?
We're gonna bake it with like cumin and a little cardamom, and salt and pepper.
Just bake it nicely. Okay.
And it comes out pretty good. It's a family favorite. And
all right.
Put cabbage with it and cheese.
Cabbage. Put cabbage rather than lettuce. Odd. Never heard of that.
Yeah.
A little chewy though, isn't it?
No, cabbage is usually crisp.
Yeah.
It's a little crisper than lettuce.
Yeah. Well, yeah, I know that, but I always kind of look at it as something a little bit chewier.
Like a coleslaw. Think of it like a coleslaw with the crema, with the lima, the crema on it.
Okay, and then what else?
We have a Grands Raising Grands group that we've started doing. It's education and support. So, you know, every month we have a topic. So this month the topic is going to be social media, internet, and apps. And we're going to have it at night. So it's going to be at 6:30. And Mark McGowan, who is our health and education coordinator, is going to run it.
And Mark is?
He's our health and education
coordinator.
Does he
work somewhere else?
He works for the Senior Center, but he also works for the King County Juvenile Justice.
Okay, so he has a pretty good idea of what goes on with social media and how that affects kids.
Yep.
Yeah. Okay. I was just kind of wondering, you know, you know, you work for the Senior Center, but so how do you relate to all the social media? So, okay, you answered that question.
Yeah. So, so we're going to be doing that February 27th. So if you know any grandparents raising grandchildren, or you're a grandparent raising grandchildren, then let them know about this new
Or you just want to
group.
know what the heck these kids are talking about, right?
And then, of course, we'll do our Medicare discussions every month, the fourth Tuesday of every month. We're going to make it at 10:15 because I leave from here and I go right to Oswego and present on this. And I usually am walking in the door at 10 o'clock.
When they're ready to go, right?
So Medicare discussions, we'll talk about supplement plans.
But again, this might be for new Medicare subscribers who are looking to say, okay, I'm going to start Medicare April 1st. I need to know what's out there.
Yeah, so supplement plans can be changed at any time for anybody, but there's, some things that you should know.
Well,
It's like you shouldn't cancel the plan that you currently have before you
have instituted the new one.
have instituted the new one, so that you're not without insurance, or that new plan doesn't accept you for some reason.
Right. How do you break it down? Most people feel like, if somebody will be going on Medicare and they'll say, I don't know what to do. I don't know who to call. There's so much to it. I just don't know what to do. I think that's really misinformation, because it really is not that difficult.
It's a lot of moving parts at first, and I think that becomes overwhelming because you got to go through Social Security to sign up for Medicare, but Medicare is then administered from the Center of Medicare and Medicaid Services, so that gets a little confusing because you're getting CMS letters and Social Security, and now there's this, because the retirement age has changed to 66 plus months depending on when you were born.
Right.
And Medicare is still 65, and Medicare is traditionally paid through Social Security. This is now causing a little more confusion of, well, who's going to pay? And I don't want to take my retirement early because I don't want to be penalized.
So what are people doing? I mean,
So they're paying out of pocket initially until they get on Social Security, and then they'll switch it over.
Yeah, then it just comes right out straight. Oh, I guess I never thought about that, what people are doing.
Yeah, so that's kind of a new nuance with Social Security and that, because it makes it a little more confusing.
But if they're privately insured, paying that 104 or 109 or
134.
130, isn't that what it is?
Yeah.
I don't know how much it is. That's still a buy.
Yeah, but that's 80% of your coverage. You still
Yeah.
have that 20% where you need a supplement plan, or you do your Medicare Advantage and do the copays.
But still, I take that Plan F. I take a high deductible because it works out the same. If you take a zero deductible, it's still going to cost you that much money, as opposed to a very high deductible and a very low premium.
Right.
So it really, to me, taking the high deductible is the best buy in the world.
So my advice to anyone going on Medicare is
Talk to me.
Sit down. No, don't talk to Anne. No, I'm just kidding. Sit down with a paper and a pencil and a calculator
and figure it out.
Figure it out.
Right. We got to take a little bit of a break. I'm looking at my watch. We just get to yapping and you never know what's next. Okay, we'll be right back with Sandy Pastore. Stick with us.
So, I just moved in with this family, and it's embarrassing. The little one, he likes to go outside and crawl around in the giant litter box. I don't know what he's doing. I mean, I was born and I knew how to use the litter box. Look at that! That's disgusting! Oh, poop already! You're making me nervous. Oh, okay, I can't look at this anymore. I really hope he grows out of this, for his sake.
We'd do anything for kids. Yet 1 in 6 children in the U.S. struggle with hunger. Help end childhood hunger near you. Learn how at feedingamerica.org.
Your son wants to get a cat, but you're allergic. Do you A, prepare yourself, B, make the best of it,
C squared equals
25.
Good job.
or C, find a loophole? When it comes to parenting, there are no perfect answers, but that's okay, because you don't have to be perfect to be a perfect parent. Teens in foster care will love you just the same.
Welcome back to Fox Valley Today. I'm here with Sandy Pastore from Oswego Senior Center, talking about some of the events that they're going to be working on, and that they're all it's kind of monthly events. And one of the things you got coming up here that we were talking about was the memory screening that you're going to be doing on no less Valentine's Day.
I was just looking at that.
This is a good day to figure out that they're going to carry you off.
Happy Valentine's.
Yeah, right. So tell us a little bit about how that works. And who does it?
So I do it, and I just meet with you individually in my office, and we do something called the St. Louis University Memory Status Assessment, and it's a tool that's a fairly it's a valid tool, and the VA uses it, for example.
The same test that you're doing. Okay.
It's just a 15-question test, but it goes through all the kind of things that might be impacted by a cognitive disease. So visuospatial, memory, math, storytelling, and being able to listen and take out information from those stories. So I personally like that test better than I like the mini mental state exam, the MMSE, which is frequently used, and I used that when I was a case manager. They're kind of the same, but the SLUMS it's called SLUMS, St. Louis University. It has a little bit more visuospatial, but also storytelling and math. So
well, that's good. And people need to make an appointment to come over and do that?
Yep.
All
So
right.
I do it in like a half-hour session, but it only takes about 15 minutes, and then we just kind of talk about how you did and what that means and what next steps would
help, what benefits you, yes.
Yep.
Your ongoing weekly exercise, the chair exercise, I had a fella on here one day, and we were talking about seniors and losing that core strength, and we were talking about the fact that, you see people that have a hard time just getting up out of a chair because they've lost the core strength in their shoulders. And so he said the best thing you can do is just practice standing straight up and down, sit up and down, and that continues to keep your joints, your core strength. Is that kind of what they're practicing over there?
The chair exercises, they're doing a lot of movement in the chair, but they're not standing up and sitting down.
Okay.
But they're lifting the legs, moving the arms,
weights.
And it's by video. So there's that one. But we do a Heart and Bones fitness class, which is more of what you're talking about. It's cardio, it's resistance training, and now it's 5 days a week.
Oh.
So we're really excited about that. Joni Grant is our instructor. And so, people were asking for morning classes, and we had done that on the Wednesdays and Fridays. We got those going. But people have also been asking me for late afternoon classes because, they don't want to get up that early.
Well, not only that, I think different times of the day help.
Yeah.
And let me just say this. I have noticed that not that the community or the listeners are concerned about this, but a lot of times I'll get heartburn after a meal. As you age, your stuff starts, or maybe you sit down in a chair. But I feel that after I eat a meal, if I go out and do 15 minutes of walking around, get on my treadmill for 15 minutes, I don't get it.
Yeah.
Because the food settles down.
Right.
And just having that in different times of the day, I think kind of gives people an idea of when they feel the best to do some of that stuff.
Right, and that's the thing too is we like having afternoon classes because we know that arthritis feels better in the afternoon.
That's right. In the morning, people are stiff. You're right.
So we want to keep people moving and grooving. This is a free class, and people love it. And she's such a great instructor.
That's Joni Grant. I was always going to get her over here and maybe talk about some of that. I don't want to miss the opportunity to talk about some of your upcoming trips.
Oh, yes. But before we talk about trips, I just want to mention on the fourth Thursday of every month, we're going to do a special celebration with our regular congregate lunch. And we're, if we have different things that we would have to pay for, we would get sponsors and things for that, just so people know that. So Winter Luau is coming up on February 22nd, and it's still that same suggested donation of $5.
Oh.
We're going to have a, not Hawaiian dance, but an Indonesian dance demonstration, and we'll have a shirt contest, and it'll be a lot of fun. So, yeah.
Are you going to have any women wearing grass skirts? You never know.
Hey, I told them to. And the if they're going to wear the grass skirts, they got to wear the coconuts.
The coconut bra, yeah.
Oh, we got a lot of trips coming up. We also have acupuncture. We're going to talk about acupuncture. We're going to do our garage sale again this year.
Oh, now last year didn't do it, did you?
We didn't do it. We're gonna streamline it. It's going to be a total of, I think, a week.
And when are you going to have it?
It's on, I'll tell you, June 9th through 11th. We'll accept donations on June 9th, and then we'll accept donations on June 11th through June 13th, and the garage sale is June 14th through the 16th.
Okay, and where are you going to have that at?
At the Senior Center.
Okay.
In the gym.
Okay.
We're going to Virginia Beach, Colonial Williamsburg, and Historic Norfolk. If you guys haven't been there.
Oh, I've
That's
been
a
to
great
all
trip.
of those, and they are let me find that. When are you doing that?
It's going to be April 29th through May 5th.
Oh, that should be beautiful. That
Yeah.
should be a beautiful time down there. And it's really not a bad ride. In fact, it's a beautiful ride.
It is.
It's a gorgeous ride to go through Appalachia.
Yeah, that's my neck of the woods there.
Is it? Well,
And
I'll tell you what, it is wonderful.
Yeah. Whenever I go home and I see the Appalachian Mountains, I feel like I'm home. You know what I mean?
Yeah. It's gorgeous.
May 2nd through the 4th. So if you're not interested in Virginia Beach, but you want to drink wine, we're going to go on a wine tour.
Okay.
Up in Michigan. They have great wine up there. They're going to go to Black Star Farms, Chantal Brice Estate, and another one, I think, too. So it'll be a lot of fun. They're going to stop at Dutch Village on the way back.
Yeah. Okay.
And then we got
Now, I want to come back to this just a little bit, this
Yeah.
Norfolk thing. What kind of shape do people need to be in to do something like that?
Well, Williamsburg is walking.
There's a lot of walking.
There's walking with that. There is some walking
The
with
beach,
it.
yeah, and the boardwalk, yeah.
But
But-
it's all accessible too.
Right.
So I know.
And there's always places to sit down. They realize that people are not always able to do all that, so.
So, Pierogi Fest is coming up July 27th. That sounds like a good time.
Yeah. Well, who doesn't want to go for a pierogi? Okay.
Right.
And you're going to do a trip to Colorado in
Colorado, August 11th through the 19th. That's a perfect time to go to Colorado. They're going to go to Garden of the Gods, the Royal Gorge, and Colorado Springs. That'll be a really nice look at Pikes Peak. So.
Wow, and the visit to the Olympic Training Center. Okay, and the Martha Vineyards in Plymouth. Oh, that looks great.
Yeah, so Cape Cod, Martha's Vineyard, and Plymouth. We do have one full bus, but she's taking a waiting list to see if we'll do a second bus too. So that's going to be a great trip too.
You've already got a busload.
Yeah. And then February 7th, we have a information session at 11:30 for the Rose Parade for next year.
Next year.
And that's going to be a flight that you're going to fly.
Okay, you're going to fly. You're going to be 5 days.
Yep.
And you're going to be the parade, a tour of Hollywood and Beverly Hills, Grauman's Chinese Theater, Hollywood Walk of Fame, Newport Beach and Laguna Beach, San Diego City Tour, and Harbor Cruise.
Yeah.
That would be wonderful.
That's a nice trip.
Yeah.
So,
Okay.
yeah, so we got all those coming up. Like I said, income taxes are coming up. Our fourth Thursdays in February is going to be the Winter Luau.
Okay. Guess what? I
So-
think we're out of time here, Sandy. I hate to cut you off. There's always a lot more to talk about. Thanks a lot for joining Fox Valley today. We'll catch you next time.